Hello and welcome to MedMind Spectrum. In this video, you will learn about the intercostal spaces. These are found in the thorax, and we shall learn about their contents, what they are, and what structures pass through these particular spaces. To begin with, as an introduction, we shall define the intercostal spaces. These are spaces between two successive ribs. And now, because we know that we have 12 pairs of ribs, which are on either side of the sternum, these 12 pairs of ribs can only create 11 spaces between them, and that means we have 11 intercostal spaces. On this illustration right on the right hand side of the slide, we can see the intercostal spaces represented by this black asterisk sign here. So this intercostal space, we can see it is in between this rib here and this rib in this position. We can look at the structure and the contents. So each intercostal space has particular contents that move along it. First and foremost are the intercostal muscles. Like we can see, the intercostal space is covered by muscles, and these are arranged in 3 layers. As illustrated on this diagram here, we have the outermost, the middle layer, and the innermost layer. So these muscles, because they are in between the ribs, we therefore call them intercostal muscles. And the 3 layers that are formed include this outer layer, which is the external intercostal, the internal intercostal muscles, and the innermost intercostal muscles. So these are the intercostal muscles, and their layers are: one is the external intercostal muscle, which is on the outside, and soon as we shall see, one identifier of this muscle is that their fibers, like you can see, the fibers of this muscle run obliquely forwards. And then in the middle we have the internal intercostal muscles, whose fibers run in the opposite direction, that is obliquely backwards. And then on the inside we have the innermost intercostal muscles, which have the same fiber orientation as the internal intercostal muscles. Besides the muscles, we also have a neurovascular bundle consisting of intercostal veins, arteries, and nerves, together with their collateral branches. These run in the costal groove alongside the rib. So that on the rib, on the lower border, we have an impression which we call the costal groove, and this costal groove transmits structures that are neurovascular, i.e. nerves and blood vessels. So from top moving downwards, we have the vein, the artery, and the nerve. And like I said already, these ones moving in the groove, they are illustrated here, shown by this asterisk you see here. And then their order or arrangement is: up we have the intercostal vein, which is blue in color here, and then followed by the intercostal artery, and lastly the intercostal nerve. These have their collateral branches, which move in the lower side of the space, which we can see in this particular position. So these are the collateral branches of these vessels. So we can now look at the intercostal muscles in particular, their detail, their origin, and how their fibers are oriented. So these are arranged in 3 layers, like I said already, and these muscles, we said the outer layer is particularly the external intercostal muscle. So this external intercostal muscle is what we see in this particular position, coming from this rib up and then moving to this rib down, with its fibers oriented in this particular direction. This is very important to identify them. So the fibers of the muscle are directed obliquely downwards, as indicated by this arrow here. So they move posteriorly to the anterior side, but at obliquely, that is obliquely forwards. And then when it comes to the middle layer, it is formed by the internal intercostal muscle, this one which we see right here. And the fibers of this muscle are directed obliquely posteriorly. So they come from anterior and then they run obliquely backwards, which we call obliquely posteriorly. So that's how their fibers are oriented, as opposed to the external intercostal muscles. And then the inner layer of muscles is a group of many muscles that sometimes we simply call the transversus thoracic muscle, as indicated right here. So it is formed by the transversus thoracic muscle, an incomplete layer of 3 separate muscles, which are the first one being the sternocostallis. This one runs from the sternum and then to to the ribs. So it is called sternocostallis. And then we have another one called the innermost intercostal muscle. This one runs in the intercostal space but on the inside. So after these two layers, the external, the internal, the next layer in the space is called the innermost intercostal muscle. And last of this group is called the subcostalis muscle, which runs in the posterior wall of the chest. The nerve supply of all these muscles, they are particularly supplied by their corresponding intercostal nerves together with their collateral branches. Now to look at each of these muscles in a detailed fashion, let's look at one by one. So to begin with, let's start with the external intercostal muscles. We shall look at first the extension, or to what extent they move, their origin, their insertion, and their action. So to begin with the extension, these begin posteriorly at the tubercle and end anteriorly at the costochondral joint. So we can see these muscles we have just identified in this illustration, one of the space. So this muscle runs from posteriorly at around the level of the tubercle. The tubercle is part of the rib. If you've not watched, please, that video on the anatomy of the ribs, you can please check it down in the description below this video and enjoy that video as well. So from the tubercle of the rib, the muscle begins and then runs obliquely forwards and ends at the level of the costochondral joint. The costochondral joint is that joint where this costal cartilage that is blue joins its respective rib. At that point, we call that one the costochondral joint. So these muscles run up to that point and they don't span the space to the sternum. So this space is completed by a membrane which is called the anterior intercostal membrane and sometimes called the external intercostal membrane. The origin of these muscles, they come from the lower border of the rib above and then they insert into the upper border of the rib below. So that means this muscle, the fibers are running from this border of this rib and then they're inserting to this border of the rib below the superior border. What do these muscles do and what is the action? These muscles aid inspiration by elevating or carrying the ribs upwards. And if you can think about this, if their origin is particularly up, muscles usually contract towards their origin. So if the origin is up and the insertion is down, when the fibers contract, they are going to carry the lower ribs upwards. And in the whole thing, we shall have the whole rib cage carried upwards and outwards, and this aids inspiration by varying intrathoracic pressures. The next muscle in line, let's look at the internal intercostal muscles. So these internal intercostal muscles, their extension, they begin anteriorly at the lateral margin of the sternum and end posteriorly at the angle of the rib, and they do that by becoming the posterior intercostal membrane. So we can see the fibers. This is our sternum here. The fibers are beginning right here from the side of the sternum. So they complete that space and then they run obliquely backwards as we see. And then at the level of the angle or that sharp corner of the rib, they don't complete the space. They end as this whitish membrane we can see in this diagram as the posterior intercostal membrane, or sometimes called the internal intercostal membrane. Regarding the origin of the muscle, it originates from the lateral border of the costal groove of the rib above. So the internal intercostal muscle also comes from the rib above, but this time round it is coming from the lateral border of the groove. And then where does it insert? Of course, it will insert on the upper border of the rib below. The action of this muscle, it is to depress the ribs, and then this is very important during expiration process. Let's look at now the innermost intercostal muscles. So these ones, their extent, they don't reach the sternum. At the same time, they don't span the whole space behind. So they begin in front of the mid-axillary line and extend backwards to end at the level of the angle of the ribs. The orientation of the fibers is similar to the internal intercostal muscles, which is simply obliquely backwards, as you can see in this particular illustration. What is their origin? Their origin is from the medial border of the costal groove of the rib above. Remember, the internal intercostal was from the lateral border. So this is from the medial border of the groove. That means these two muscles, they cover the groove. One muscle is on the other side of the groove, and then the other group of muscle is on the other side of the groove. And this is very important because the neurovascular band of structures runs in between these two layers of muscles, the internal intercostal muscles and the innermost intercostal muscles. But do not forget, the innermost intercostal muscles is a muscle that is part of the larger group called the transversus thoracis muscle. So in this particular case, we are looking at the innermost intercostal muscle, and the insertion, all of them, they insert on the rib below. So it inserts onto the upper border of the rib below, and the action is depression of the ribs during expiration. So they are also muscles of expiration. Regarding our next muscle, which is the sternocostallis muscle, you can see this is a view from the inside of the chest. That is on the posterior side of the sternum, inside the cavity. We can see the muscle having attachments on the sternum, at the same time attachments on the ribs. That's why we call it the sternocostallis, to mean from the sternum to the ribs, which are identified by that word costal. So the extension of this muscle, it lies in the anterior part of the inner surface of the thoracic wall, extending from the back of the sternum to the costal cartilages, the second up to the sixth. So in this illustration, the second has not been illustrated, but you have to understand and know it better, that this muscle usually spans from this second one up to the sixth costal cartilage. So this is called the sternocostallis. The origin, it is from the posterior aspect of the lower half of the sternum, and the insertion is on the costal cartilages on the inner surface of the second to the sixth costal cartilages. What is the action of this muscle? It is also a muscle of expiration and basically works by depressing the ribs to aid expiration. Lastly, we have the subcostalis muscle. Now this muscle is found in the posterior wall of the chest, unlike the sternocostallis that was located in the anterior wall of the chest. So this space that we see here is a space that was originally covered by the vertebra or the vertebral column. So we can see these muscles running from one rib to another. They are particularly in the posterior wall, and whenever they are moving to insert, they skip one rib. Like this one here, it attaches on this rib, we skip this rib and then attaches on the other. This one from this one to that one, and this one to that one. So we call this the subcostalis muscle. So what is the extent of this muscle? This muscle lies in the posterior part, like I mentioned, and on the inner surface of the thoracic wall, mainly in the lower part. We can see these are the last two ribs. So it is lying in the lower part of the chest wall. And the origin is, it comes from the inner surfaces of the last ribs. That is the rib 12, rib 11, and rib 10. So it comes from the inner surfaces and then inserts upwards. So what is the insertion? It inserts on the upper border of the second or third rib below, away from the origin. That is, if this is rib 12, the second would be this one here, or the third would be this one here. So when you count 1, 2, or 3 ribs away, that is the insertion. So if this is rib 12, when we count 1 rib away and then we go to the next rib, that is the second rib, that's where it will insert. If this is rib 11, count 1 away and then the next one, that's where it will insert. So that's how they insert. So the action of this muscle is to depress the ribs and also aid in expiration. So it means the transversalis muscle, that is the transversus thoracis. So it means the transversus thoracis group of muscles together with the internal intercostal muscles are all muscles of expiration. So in brief, those are the intercostal muscles that we have in these spaces, and we can now look at how these muscles relate with the neurovasculature and how they pierce or traverse through these spaces. So we have an illustration here. This is our rib and this is a rib below. In between the ribs is the intercostal space, which is covered by a layer of muscles, which we can see we have the outer layer, the external intercostal, the inner layer, the internal intercostal, and this innermost layer, which is the innermost intercostal muscle. At the lower border of each rib, we have this costal groove, which transmits structures in the order of the vein, artery, and the nerve. In front here, we have our sternum. Posterior, we have our vertebrae, and we have our arteries here. These intercostal arteries and veins are in two categories. We have the ones on the posterior wall, which we call the posterior intercostal arteries and veins, and the ones on the anterior wall, which we call the anterior intercostal arteries and veins. And then our nerves come from behind, right away from the vertebral column, and span the space to move anteriorly, where they will terminate at this point. So in this particular diagram, we want to appreciate what are the different kind of relations that relate these particular structures to the spaces and the muscles there. So one of them, we can see that when these structures are entering, they pierce this posterior intercostal membrane, also called the internal intercostal membrane, because it lies on the innermost side. And then we see these structures running in between the innermost layer of muscle, that is the innermost intercostal, and then between also this internal intercostal muscle. So the neurovasculature runs in between the innermost intercostal muscle and the internal intercostal muscle. So in figure 1 here, we have, this is the posterior intercostal artery together with its vein on the superior part. So this blue is the vein and this one below is the artery, and these are posterior intercostal arteries and veins because they are running on the posterior chest wall. And then anterior, we have the anterior intercostal artery and vein, which are running from the anterior chest wall. So we can see this is right here is the descending aorta or thoracic aorta. So you can see our thoracic aorta giving rise to this artery here. And then this vein is coming from the azygos vein. So this vein here is azygos vein, which is soon joining the superior vena cava. So this azygos vein receives venous drainage from these posterior intercostal veins, many of them. And then anteriorly, we have these vessels here, which are the internal thoracic vessels, that is internal thoracic artery on the medial side, the internal thoracic vein on the lateral side, which are the sources or the vein it receives these anterior intercostal vessels, that is the artery and the vein. So on the lateral wall here, we can see their lateral branches. So the branches from the artery and the branch from the nerve in the lateral wall, these are their lateral branches, and that means these branches perforate through the muscles to come on the surface. And then from that point there, we can also see these collateral branches. After giving off these collateral branches, they leave the border or the groove and then move on the superior border of the rib that is below. So these are collateral branches of the intercostal vessels and nerves, and then they will move all the way this side on the anterior intercostal membrane, where we shall have the nerve terminating as the anterior cutaneous nerve, this one here, which is going to innervate the cutaneous part of the anterior chest wall. And then also we shall have these perforating branches from the intercostal vessels. One is from the artery, and then we have these perforating ones that are joining the vein to carry venous drainage from this anterior chest wall. So in summary, these are the relations, the details of these posterior intercostal arteries, the veins, nerve supply, arterial supply of the chest wall, venous drain of the chest wall. These are discussed in detail in another video, which you can also check out and enjoy that content as well. If you really found this video helpful about the intercostal spaces, don't forget to like, comment down in the description below, and also most importantly, subscribe to our channel to enable us continue providing you all this content. Good luck in your next test, and see you in the next video.